Now, Malawi and the United Nations Children Fund, UNICEF, have recently opened an air corridor to test the effectiveness of drones in humanitarian emergencies and for other development uses. The test corridor is centered at the Kasungu Aerodrome with a 40-kilometer radius and focusing on 3 tasks: generating aerial images of crisis situations, using drones to extend Wi-Fi or mobile phone signals across difficult terrain in emergencies, and delivering low-weight emergency supplies. Landlocked Malawi has limited road access in many of its rural areas, which makes it difficult to get help to needy communities.
The innovation will help us in a number of ways. Apart from delivering, medical samples to testing laboratories, it can also do a lot of mapping, land surveying, and several other important, activities.
So you can really see what can drones do in terms of transport, bring medical supplies to health centers, or bring educational supplies to school. What can they do in terms of connectivity in areas where we don't have coverage of the telecommunications network? And they can also show what we can do with the imagery they acquire in terms of mapping out road networks, mapping out natural environment degradation, mapping out infrastructure. And basically it's open for private sector to explore, and it puts Malawi on the map.
Kenya is the first African country to start using a modern generic version of the latest HIV drug that can improve and prolong the lives of tens of thousands of people who suffer severe side effects and resistance to treatments. Dolutegravir, or DTG, is a medication used for the treatment of HIV infection. A generic version of dolutegravir, first approved in the United States in 2013, is being given to 20,000 patients in Kenya and was officially launched recently in the capital, Nairobi. It is the drug of choice for people with HIV in high-income countries who have never taken antiretroviral therapy before, and for those who have developed a resistance to other treatment.
More effective drugs, more effective regimen, fewer side effects, and name them. So to us, I think in HIV care, in TB care.
Datiest Ogutu, who has been living with HIV for 15 years, started taking the drug this year. She says this treatment suits her better than her previous one.
Some people think it's a myth, but it's a reality that you actually get nightmares. And then with the favirenz, I developed a condition of anemia, because it would wear me out and it would drain me, and my body cells would not reproduce themselves. So unlike now that you can see me and my flesh looks full of life, you can't tell whether I'm sick or not, and else I tell you.
The brand name version of DTG is Tivacay, produced by VIIV Healthcare, majority owned by GlaxoSmithKline. DTG will first target about 27,000 people before being rolled out countrywide. Professor Sylvia Ojo is the Kenya Country Director for the University of Maryland School of Medicine and is monitoring the introduction of DTG.
85% suggests that the majority of patients are tolerating their treatment. Now, the 15% could be people who are non-adherent for various reasons, could be people who are experiencing toxicity, or could be people who failed for one way or the other for reasons that may not be clear.
Kenya is working with UNITAID to make medicines more readily available and fast, to reduce manufacturing costs by allowing generic companies to access patents for a small royalty and produce them cheaply for the developing world.
All the 1.5 million people living with HIV need to be on treatment. As I mentioned, about 1 million and above are already on treatment. So we are looking for about 400,000, because some are already in the system and we are working them out.
Observers say Kenya has made great strides in addressing HIV. The number of new infections in Kenya has almost halved over the last decade to 80,000 a year, thanks to increased testing, treatment, and awareness. UNAIDS aims to reach 90% of people diagnosed with HIV with antiretroviral treatment by 2020.